Welcome to the Deep Dive. Today we're looking into something pretty serious, actually. It affects almost half of all pregnancies globally. We're talking about iron deficiency. It's this hidden crisis impacting both mother and baby. And what's really surprising, the key thing here is that it's largely preventable and treatable too, yet it's still this massive global health challenge.
It really is a striking paradox, isn't it? Such a common issue, but with potentially serious consequences, and often it just goes undetected until things are quite advanced. So our mission today really is to understand the huge iron demands during pregnancy and the risks, the very real risks of deficiency for both mother and child, and, well, how to manage it best.
Exactly. And to really get a sense of this hidden crisis, let's maybe zero in on just how common it is, because the numbers, frankly, they're staggering. Globally, about 37% of pregnant women are anemic, mostly because of low iron. But get this, in places like North America, over half, more than 50% of pregnancies involve iron deficiency. And a good chunk of those develop into actual iron deficiency anemia.
That's just a monumental demand on the body. Even if you have a perfect diet, your body needs roughly an extra 1,000 milligrams of iron during pregnancy. And that 1,000 milligrams, it's not just a number. It's like this physiological gap that most women's iron stores just can't cover. This depletion happens silently, often totally unnoticed. It supports the extra blood volume, the baby's growth, the placenta, and prepares for delivery too.
Yeah.
Most women just don't start pregnancy with those kinds of reserves. And it tends to get worse as the pregnancy goes on. The third trimester, that's when rates are highest.
Yeah, and it's so easy to just brush off fatigue as, just part of being pregnant. But the actual consequences, they go way beyond just feeling tired, don't they?
Oh, absolutely.
The impact on both mother and baby can be surprisingly severe. For mothers, we're looking at something like a 40% higher risk of preterm labor, C-sections, and postpartum hemorrhage. And then there's the chronic fatigue, poor concentration, even a higher risk of postpartum depression.
And that impact can be really long-term, especially for the baby. For babies born to mothers with iron deficiency, the risks include low birth weight, being born too early, and, well, in severe cases, even stillbirth. But maybe the most concerning thing is the effect on neurodevelopment. Iron is absolutely critical for the baby's brain development. It affects how those neural connections form. Low iron can lead to impaired cognitive development, memory issues, behavioral problems, and these things can stick around for years.
Okay, so given these symptoms can be subtle, what are doctors actually looking for, to catch it early? And what makes diagnosing it during pregnancy so tricky?
Yeah, diagnosing it in pregnancy has these unique challenges because the normal changes, like hormones and blood volume shifts, they can actually mask the signs. It makes it a particularly cunning foe, you could say. For instance, just the natural increase in blood volume dilutes red blood cells. So the standard anemia tests might not be reliable on their own unless you also check iron stores directly. So we're looking at things like a complete blood count, sure, but crucially, ferritin levels. Think of ferritin as your body's iron savings account. If that account drops below 30 micrograms per liter, that's a clear red flag for deficiency. Even before anemia actually shows up, most guidelines recommend checking these levels early on and then again in the second trimester.
That brings up a really critical point because it highlights this tension, right, between pushing for early universal detection versus the debate over whether there's insufficient evidence. A lot of women with iron deficiency aren't technically anemic yet, and standard blood tests might miss the deficiency until it's pretty far along.
Exactly. And that's why some experts argue for universal ferritin screening. Check everyone, rather than waiting for anemia to develop. But that position, it contrasts with a recent finding from the U.S. Preventive Services Task Force. They're a major U.S. health body, and they found there wasn't enough evidence for routine screening in women without symptoms. So it's still a point of debate, really, for wider policy.
That is a fascinating tension. Okay, but let's switch gears to the positive side. Once it is identified, how well can we actually treat it?
Well, the good news is we can treat it effectively. Oral iron supplements are usually the first step for mild to moderate deficiency. Doses are typically around 80 to 100 milligrams of elemental iron daily. That's the actual active iron part. Recent reviews show this can cut maternal anemia by about 70%, which is huge. Though maybe up to 30% of women get GI side effects like nausea, constipation, and that can make it really tough to stick with the treatment plan.
Right, and that's a crucial hurdle, isn't it? If people can't stick with it, we're not really solving the problem.
Exactly. And it's interesting how strategies to improve that have evolved, like taking it every other day might reduce side effects. And taking iron on an empty stomach, maybe with some vitamin C, helps maximize absorption.
True.
For more severe cases, though, or if oral iron just isn't tolerated or isn't working well enough, intravenous or IV iron is being used more and more. It works faster, more reliably, but it does come at a higher cost.
So what does all this mean for you listening? Well, it's about starting iron early if your doctor advises it, monitoring how you respond, and really never ignoring symptoms like serious fatigue or weakness. Working closely with your healthcare provider is absolutely key to finding the right treatment for you. It needs to be individualized.
And if we connect this to the bigger picture, addressing iron deficiency in pregnancy isn't just about having a healthier 9 months. It's really about safeguarding brain development, laying the foundation for a child's cognitive abilities, their overall well-being, for years down the line. Which raises, I think, a really important question. What more can we collectively do, to make sure every single pregnancy gets the optimal nutrition, especially the vital iron it needs?
Thank you for joining us on this depth dive. We hope this insight helps you navigate this really crucial aspect of maternal and fetal health.